In just 8 days, the ACA subsidies, which helped millions of families across the country deal with rising health care costs, end. Is that it? Let's bring in a member from each side, okay? Democrat, member of Congress, Adam Smith. Republican, member of Congress, Randy Fine. Fine is Florida, Smith is Washington. Good to have you both. First of all, thank you for coming on the show. Thank you for coming on together and with a member of the other party again and again for the audience at News Nation. It matters. It matters increasingly. So thank you both. Randy, I start with you because it's your fault. You guys went home. Do you believe in the new year, the first item up is restoring the subsidies and starting to do something about health care?
Well, thanks for having me. Look, I certainly hope not, because restoring COVID-era emergency subsidies that were being given to 58,000 dead people, that 100% of the time the GAO could fraudulently get people put on these plans, that's not a good solution for Americans. These subsidies were only going to 7% of Americans, which is why before we left Washington, House Republicans passed a health care bill that would have lowered costs by 11% for everyone, had PBM reform, and also allowed associations to begin to offer increased plans as well. So we're focused on solving the problem for all Americans, not by continuing to bail out the Unaffordable Care Act created by Democrats.
Adam, what's your response?
Yeah, well, first of all, that plan would have no way on earth would it have reduced healthcare costs by 11% for all Americans. That is simply false, or a guess at best. It would have helped a little bit with cost sharing for some. It did a small piece of the larger problem. It didn't address the broader problem. And look, extending the ACA tax credits doesn't address the broader problem either. It doesn't do what Randy just described. It helps millions of Americans, actually. And yes, there is some fraud in it. There's fraud in Medicare. There's fraud in Medicaid. Believe it or not, there is fraud at the Department of Defense. And we have to get after all of that. But that doesn't mean that we don't help Americans be able to afford health care. And extending the ACA tax credits is one of the cleanest ways to help the most people in the short term be able to afford health care. But the big problem is that we spend more money on health care in the U.S. than any other country in the world. It's about twice as much on a per capita basis. We have got to get those costs under control. That's the only way to help Americans ultimately afford insurance. We can't keep subsidizing it forever as costs go up and up and up.
Adam, you're home, so I'm not as worried about your party coming and hunting you down. They won't be able to find you. Is it wrong to say the president is onto something? If he calls in all the big shots, and of course you're going to have the right and left leadership there, and says, either you're going to do this with us or we're going to do it without you. Something has to change on costs. What do you think about that as a starting point?
Well, if the president was willing to do that, I think that would be great. Unfortunately, the president has been either running for office or in office for 9 years now, and he's been promising us the most miraculous health care plan the world has ever seen and delivered exactly nothing. And I think both parts of that are a problem. The president coming up there and saying, gosh, if I was in charge, health care, it's easy, it's simple. I'd pass this plan. People would get everything they want. It wouldn't cost that much. That's dishonest. Nobody has that plan. Healthcare is difficult. It's very expensive. People have big demands, big needs, and there's only so much money. But second, having not produced anything in that 9-year period sort of puts the lie to the promise. But look, if he wants to bring everyone together and say, hey, we got to get costs under control, I think this should be a top priority for the president and for Congress going into next year, without question.
I mean, Randy, for the midterms, affordability is going to be, top priority. Sure, housing costs are top, but this is right there in terms of what people are taking on debt for. And look, Adam, just fair point. The president said, this is his idea. He said, I'm going to call these guys in. I know them. They respect me. And if they don't, they're going to. And so he said it. If that happens, Randy, do you believe it's real? And do you think that could be the start?
I do. And I want to point out that all of this discussion about extending the subsidies was only for 7% of Americans. Democrats had no plan for the other 93%. And what I heard my colleagues say is what we did was a good idea, but it didn't solve all of the problem. I guess that's why all Democrats voted against it. There are things that we can do. I'll give you one example. We need to bring back catastrophic plans. For most Americans, they want health insurance if they get hit by a bus or, God forbid, they get cancer. They don't need the government getting involved in their everyday decisions, their flu shots, their birth control, their annual physical. They can buy that on their own. It's how we buy auto insurance. And we have not introduced that yet. And it's my hope that as
Randy,
we come back after the first of the year,
Randy, I think that's a fine idea.
Buy plans that are more affordable.
I think it's a fine idea to have the table. It's just a very small slice of people.
I'm sorry,
and Adam's not against that idea either. Go ahead.
No, I am against that idea, and let me tell you why. Because that's the problem with health insurance. If you set up a situation where you say, okay, healthy people, we're going to have you pay a lot less for health care and give all this health care that you don't have to have. All right. Then we will cherry pick all of the healthy people, and then the sick people won't be able to afford health insurance. That's the single biggest problem with this approach. Look, if you're going to have insurance, somebody's going to have to pay more into it than they're getting back, or it's simply not going to work. That's the problem. And the problem with healthcare is it's different than auto insurance. You can drive safely. You can do a bunch of different things. Healthcare, if you live long enough, odds are you're going to have big healthcare expenses. Then you're going to want healthcare
at the end.
But if you take all the healthy people out of the pool, those people
that was the problem with the mandate.
I
didn't mean I meant you are in favor of having the biggest pool and then people get the plan that works for them. That's what I meant. I didn't mean cutting them out. And look, let's be honest. The individual mandate, which is the only thing the Republicans have done effectively here, right, is you got rid of the mandate. That was the keystone idea that came from the Heritage Foundation, which was where the ACA was based.
Without the individual mandate, healthcare doesn't work. It doesn't work.
There is no individual mandate, which is why it doesn't.
You guys got rid of it.
I know, but the reason you guys got rid of it was to destroy the ACA, and now we have a weak ACA and nothing to replace it. All right, let's leave it there. We'll pick it up in the new year. I wish both of you and your families all good things, clear eyes and full hearts for the new year. I'll be here. You guys have the opportunity to make the case as always. God bless and be well. 4 minutes and 15 seconds.